Baby's out.
Resuscitation.
We have the baby.
It's an amazing feeling getting to see everyone, but then also like being hands-on.
I think our students are really lucky that they get clinical learning really from day one, because they are in a clinical setting every other week in the first year. But now in phase 2, we've sort of flipped that, and so they're in the clinical learning environment most of the time, and we just have them one half day where we get to take all the learning together.
Section.
Today is called a LEAP, or a learning and pondering session, and the title is When One Patient Becomes Two, and so it's centered around pregnancy and the newborn phase.
It was really good to have all the physicians there and just really being interactive with us.
What we were doing in my room was the postpartum visit, or the 4th trimester. And so we did a case around a patient who developed postpartum depression. And then the second half, to weave in that basic science, we brought the students the holoanatomy lenses. So they were actually able to look at pelvic anatomy.
With the HoloLens, you can just kind of see the textbook version of this is what you would see if there was like a perfect anatomical representation of something.
And think of it as basically surgeons from a surgical perspective. So when they're looking in a pelvis and doing surgery, knowing the structures that they need to be able to identify and avoid causing issues during a surgery, essentially.
In a way, it makes it easier to just understand in a broad scope. So if you get a chance to both do the HoloLens and go in person and do a cadaver, I think that's going to work really great for people going forward.
Okay, but you put your hands over here on each side.
As a baby is born and as they're growing physiologically, they're having changes that are happening to them.
The students are going through 4 different sessions today, where they're starting from somebody finding out they're pregnant, to delivering a baby and having some complications, to resuscitating the newborn, talking about care of the newborn.
So just being able to understand the differences when a baby's initially first born versus when they're a month old, 3 months old, 6 months old, the different reflexes that they should be having, and the different social cues, or the way they talk, or the movements they do, the way that they interact with people, that's what we were trying to get. That's what's really important, is to identify those small details from the developmental milestones.
So it's sort of relating OB-GYN and pediatrics and family medicine, those 3 different specialties that they're doing weekly, and seeing how they all kind of connect. It's a great way for them to start pulling those pieces together and seeing how we think about patients clinically.
As a baby, I guarantee you that the eyes will open. When the baby's like this, and so you get your ophthalmoscope and you look at it and the baby's eyes open. But you have to be careful because they will spittle on you.